Growing up, I was always interested in martial arts, and I was roughly 19, 20 years old and in a tournament. And here I am in pretty decent shape. Of course, I'm young, and I'm doing all the workouts and getting ready for this tournament, and I go into this martial art tournament, and I'm in this ring, if you will. It's about 3 minutes long with this tournament, and there's different rounds. So here I am, ready to go, and this guy, my first time, and I'm ready to go, and I'm fighting. I'm doing this, and we're not sparring, we're kicking and blocking and the whole nine, and I'm about a minute in, and I can't breathe. And it wasn't like an asthma can't breathe. Shortness of breath hit me really, really bad. And I like, when is it? And I yelled, believe it or not, at the judges, and I said, when is it over? When is it over? I couldn't breathe, and I was 19. And then 21 shows up. And of course, I'm a little bit of a dancer, so I'm going to different clubs and dancing and all that kind of stuff. For hours, I would try to dance, and I would dance and dance. Here it comes again. I can't breathe. Like, what's going on? Now I'm in my late 20s, getting in early 30s, and I was doing construction and that kind of thing, and finishing going to school to be a chiropractor. And in the interim of getting my board exams completed, I'm working during the day building all these different construction, like custom kitchens and that kind of thing. And at the end of the day, long day, you take your work boots off, and I wanted to rip my skin off on my feet. It just started itching like crazy, and I didn't know why. And it didn't happen all the time. And maybe it was a rash, and people put some Neosporin on it or cortisone cream and that kind of thing, and it'll go away, but it didn't. And then fast forward, now I'm a doctor, seeing patients, and fast forward into 10 years into being a doctor, and I noticed that I'm foggy. I wake up and I have a little bit of energy, and I'm finding myself like I'm in a fog. I'm like, oh, shake this. I just feel irritable, but I'm in a fog. I'm just not clear. I'm not feeling like me. So here I am having a difficult time breathing when I exert myself. I'm noticing that my skin is itching, and I'm having these breakouts on my knuckles and my feet. And now I'm in a fog. Like, what's going on with me? So I'm under chiropractic care, restoring my nerve system, but there's a piece missing somewhere. And I couldn't figure out what it was. And so then I thought, what about the blood? How am I fueling my body? Because again, growing up, you feel invincible. You can eat whatever you want. But now as you're getting a little older, now I'm 50, but now you're getting a little bit older, and you just go, what am I doing? What am I doing? And I find myself struggling. As a doctor, are you really taking care of you the way you're supposed to be taking care of you? Because if you're giving advice to your patients, are you following your own advice? So I started to put together a blood work program, because I wanted to know, am I really fueling my body? I know that my spine and my nervous system is what keeps me alive, but now how am I fueling my body so it can work at its best? And I really didn't know how. So I started to get some blood work, and I really started studying my blood work and getting more panels of blood work and more panels. And then finally I said, know what? I'm gonna get a panel on this, a panel on that, and I'm finding all of these different things. I find out that I've got this inflammatory process going on inside of me, and I have a parasite infection. My lead count is 3 times the normal. I have the MTHFR gene mutation, so there's a DNA oops, if you will, in the gene mutation. So certain supplements I take aren't even working at all. And I'm like, if I find out all of these things, if I found out all these things about me, what about my patients? So today, I know exactly how to fuel my body. I knew which cleanser things to avoid based on inflammatory markers of what I should and should not do. Because let's face it, if we look different on the outside, we're all different on the inside. I've dissected over 30 bodies, and no 2 hearts look the same, no 2 livers look the same, no 2 bones look the same, even though we all have them. So how are you fueling the body the right way? And this is what I question. Finally, this is what hit me the most. I have 2 children, and I play a little bit with them, just a little bit. And I was running up and down the stairs, just goofing around, being silly. And then we only had 10, 15 stairs at our house. And I run up the stairs, and I actually was holding a laundry basket. And I was running up the stairs, chasing my little guy, and I dropped to my knees. And I dropped to my knees, and I couldn't breathe. I was like, what is going on? I couldn't breathe. So I noticed when I exerted my heart, remember when I was in the martial arts, 30 years ago, when I was doing the martial arts tournament, that same pain in my chest, felt like I was having a heart attack, I couldn't breathe. What was going on? There was an inflammatory process. I didn't have any magnesium. My homocysteine levels within my blood was way off, so I had a huge inflammatory marker. And when I exert my heart, my arteries collapsed, and they couldn't push enough blood. That's what was going on with me. So now today, I feel like I'm wearing a cape. I no longer have any issues. I just finished a trampoline park, believe it or not, with my kids about an hour ago shooting this. And I have no problem doing all of that. I can do 30 pull-ups at a time, 100 push-ups at one setting. The strength is phenomenal. Here's the thing. Oh, you're a guy, you're supposed to be this way. I can never be that way. You know, men have it easy. I know a lot of women will say that to me. Hold on a second. It's not a male or female thing. It's how you are taking care of you. I know that every 6 weeks I have a new liver. I know every 4 months I have new blood. I know every 35 days I have new skin. All of these things are occurring without me thinking about it. So if those things are occurring without me thinking about it, we have to get out of our own way, thinking about what we can't do, or even worse off, is this good for me or is it bad for me? So many of us take things and say, oh, is that good for me or is that bad for me? We never think of good for me. Is it bad for me? Don't do that. You don't run across the street. You're going to get hit by a car. Why would we say that to somebody? Why wouldn't we tell somebody, don't run across the street. I love you. I don't want you to get hurt. Don't touch that stove. You're going to get burned. Please don't touch the stove. It's hot. I don't want you to get hurt. See the difference? You know, if I tell people, don't chew gum. Why? Is it bad for me? No. Is it good for you? You know, oh, what are you drinking that Coke for? Is it good for me or is it bad for me? Trust me, we all cheat. But all of us have a little bit of a vice, some way or somehow. Believe it or not, that vice is controlling you. Hence why they call it a vice. You have to think about, is it good for me from now on? That's what I've done. At More Than Health, what we talk about is this thing called loving your life. There's a program that's eventually going to grow into this thing called the Agape Life Course. It's a 12-month course, if you will, program that helps you, like month one, for instance. Month one, we create a vision and a mission statement for you and your life. Every business has that. Do you have that for your personal life? Most don't. But once you have a vision and mission statement, now all the other decisions you're going to make in your life should be based on that vision and mission statement. From your health, to your relationships, to your work relationships, to your spiritual relationship, to your physical relationships. I mean, we're surrounded by relationships. This is why I truly believe that if the body can grow into a problem, like mine did, there's got to be a way to have it ungrow out of its problem, at least to its best ability, because we're doing this thing called age. Heck, at one time I used to have hair. And so when these things occur and the body's growing into its problem, what are you doing about it? Most people look for drugs or surgery. But why? Because that's what we've been taught. There's got to be a way to take care of the body on every level, physically, emotionally, spiritually. And when you're doing that, you're just being the best version of you. Hence, you learn to love your life. That's why at More Than Health, we believe life isn't just about feeling good, it's about function. It's about fueling your body on every level. That's why we do what we do.